Hi everyone, it's Marilyn. I'm going to attempt to do a screencast for this visit workflow for pre-op appointments. This is the first time I've ever done this, so fingers crossed. The reason I'm doing this is basically to get consistency across routine visits, decrease clinical variation, and make sure that nothing is missed. So let's start with an appointment. So before you get the patient, got a test patient here, just do the usual, that it's with staff, pick a room number. At Brambleton, we usually will pick a reason and counter reason so that it shows up on the schedule. So there's a pre-op consult that you can click on. And then for the HPI, the template we're going to use is pre-operative medical clearance. If your provider has already made a pre-op saved finding using that template, then certainly you can find it in the used save findings section. So you go and get the patient. Let's save first. So go and get the patient. You can put all the vitals in. Then you can get started on the actual HPI. So basically, we need to get this whole section as complete as possible. So let's just make a fake reason. So the surgery is going to be gallbladder removal. And we'll say the reason is right upper quadrant pain for 2 months. So the date is 12/10. Location is hospital. Surgeon is Dr. Burt. Proposed anesthesia, I usually leave this blank, don't know. And then the next thing is risk factors. So go through, find out if they have any history of any surgical complications, if they have any reasons to bleed easily, or if they have any history of blood clots. And then down at current symptoms, find out how they're feeling. Are they sick right now? Are they feeling good? Do they have any fever, chest pain, recently passed out and don't know the reason why, shortness of breath, abdominal pain, urinary issues, or if there's anything not in this list that they come up with, just type it there. The next section, education. Basically, I would just encourage people to do the discussed herbal supplements and over-the-counter medication effects. If you remember, this was in the previous pre-op template that we use in all scripts. So certainly you can go ahead and click on this and then discuss it once you get to the medication section. So next is allergies. Obviously, if they have an allergy, let's say amoxicillin, then put the reason why. If they don't have any allergy, then just click no known drug allergies. Next thing, medications. If they don't have any, do none reported. Make sure to go through every prescription, over-the-counter medicine, herbal supplement, vitamin, and put that in this list. Next, vaccines. Definitely make sure that they have a Tdap, a flu shot if it's flu season, and then also make sure they have a pneumonia vaccine. If you know that they're a smoker, they have asthma, diabetes, or they're over 65 years old. So we're going to jump down to surgical history. So I've already added one here, just put in an appendix. So basically, if they have any surgeries, use this list to pick one. If it's not in the list, you can use other and add, and then type in the date and the note of the surgery. Yeah, that's it for that. Let's go down to the next thing, which would be family history. As with all appointments, we need to make sure that there's at least one structured item for a first-degree relative. So let's just do another example. Do mother and add it, and then we'll just type in breast cancer, and we'll pick the first thing it comes up with and hit save. So remember, do this at every appointment. For social history, for pre-ops, let's try to get smoking and alcohol status in there. So usually, if adult general social history is unchecked, you're only going to see these 3 items. So if you just check on it, then you'll get, everything to drop down. So there's smoking right there and alcohol intake. You can always feel free to put how much alcohol intake they actually do or how many cigarettes they smoke a day. So we'll move down. Actually, let's go back up to one other thing because I didn't want to do this in the beginning, which is the problems. So obviously this is a test patient and I don't have any problems in my list, but basically, everybody who's been transferred over could have anywhere from a couple to 50 different things. So it's really good to try to hide everything that's basically irrelevant to their present day health status. We should really try to do this at every appointment, but especially for H&Ps when we do them for pre-ops and we print out these page-long lists that are just not helpful to the surgeon at all. So let's really try to clean that up. Okay, so we're going to go down to the assessment and plan, and we're going to go to diagnosis order set, and we're going to search pre-op exam. So we're going to use this one right here. So if you haven't added this to your order sets, you are not going to be able to find it. So let's go over on this section and I'll show you how to do that. So you're going to go to the gear, you're going to click order sets, then you're going to pick M. Snyder, and then you can just type in the word pre-op and filter. So here on yours it would say subscribe if you don't have it, or it'd say unsubscribe if you have it. So obviously if it says unsubscribe, you have it, you don't need to do this again. But if it says subscribe, then you would just click subscribe and then close out of this and then go back, reopen your encounter, and then it should be there. So let's go back to the appointment. So after you add that order set, you also need to add a diagnosis for why they're having the surgery. So with a gallbladder removal, we could just use, right upper quadrant pain, and that would be totally sufficient. You don't have to get too detailed. Under patient instructions or discussion notes in either of these, the first time you do this, type in patient cleared for surgery, and then save as template, type in pre-op clearance, and then hit save. So what that does is, I've already done it, so I'm going to take this away. When you hit templates, you're going to see pre-op clearance, and it's going to be in there, and you never have to type it again. And actually, it doesn't matter which one of these you choose, you're going to see the template in both sections. Okay. So one more thing to talk about is EKG ordering. Unfortunately, I don't have the EKG computer, so I can't go through it step by step. But there's just one thing to change to the process, and that's when you get to the screen of doing the EKG. So every nurse and MA, basically in the reviewed by section, go ahead and type whichever provider is going to see the patient. This one you don't have to type the date right here like I did. The reason I did is because I couldn't type it here, but I realized after the fact that it added it for me automatically. So like I said, don't worry about putting the date here. Just put the name and save and go through, and then I'll show you what it looks like on this screenshot of the EKG results. So you'll see here it says reviewed by my name. You put the date, and then what it does is it takes away this comment over here that says unconfirmed status or unconfirmed report. So that goes away, so then the surgeons don't have to worry that nobody looked at it in case you guys don't physically sign it. So that's just something I wanted to go over. And obviously if it comes up, people not sure how to do it, then if you're in the Brambleton office, then certainly grab me and I can show you, or if other people know how to do it, then they can show other people too. So we'll go back to the visit. So everything is basically finished. We're going to put the pre-op clearance back in here. Hit save just to make sure. And then do done with intake. So next the provider, is going to take over the encounter, review all the information, add any pertinent details, review of systems, physical exam, and then that should make it really easy to close this in a timely manner. So I hope this is helpful, and I appreciate any feedback, and I hope everybody has a good weekend. Bye.